Recovery after surgery, first few days it's important to reduce swelling with ice and elevation. Gentle movement is also very helpful initially, just walking. I generally have you use crutches but put all of your weight on the leg, and then I have you go to a cane for 4 weeks after the surgery to protect against a fall and an injury to the femoral neck. But ice and elevation are very helpful the first few days to reduce swelling and inflammation. The exercises after surgery that can be quite helpful are what I found to be the two best are stationary bike and pool therapy. Stationary bike, fairly self-explanatory, gentle pedaling, mainly using your opposite leg to push the pedals around and following along with your surgical leg is quite helpful, making sure your seat's not down too low so your knees aren't coming up too high. Recumbent bike is fine too. Generally you don't want to bike outside at this early stage just to avoid a fall. Once you feel confident and strong though, I think biking outside would be fine in a controlled way. Pool therapy is excellent. That's one of the best things that I've seen to get people back to where they should be. What you're doing in the pool is just walking back and forth, sidestepping back and forth in the shallow end, moving the leg through the water with the gentle resistance of the water is quite therapeutic. And then you can start doing some water aerobics, moving the legs in more positions and movements with more resistance as things progress. Physical therapy can be helpful. It's not important to work on range of motion or strength the first 2 months. I really like you to keep things in the mid-range, gentle movement, and the only thing that I've seen that I don't like to see as much with physical therapy is strength is an emphasis on extreme ranges of motion and heavy strengthening. You don't want to do this the first 2 months particularly. It will make you more sore. It will aggravate the hip. It's not the way to recover. Generally, recover after surgery from this type of surgery can be longer than one expects. The incisions are very small, but the work of the bone and soft tissues can take a number of months to fully heal. And then the damage to the cartilage, the original reason why we're there, the labral damage and even the articular cartilage damage, can take many months to fully settle down. So it's important to realize that extremes of motion are going to be painful, high resistance activities are going to be painful initially, and it can take 3 to 5 months for things to fully settle down. So being prepared for that, slowly increasing your activities, doing things at a light level, at a mid-range of motion early on, and avoiding the extreme positions is quite important to maximize your recovery and minimize the length of time to that maximum recovery. So I can't overemphasize the need to take things slowly. Pool therapy, stationary bike, mid-range of motion, avoiding the extremes of motion, and not be concerned with strengthening and extremes of motion the first 2 months particularly. And even after that it can be another month, but listening to your hip, listening to the pain, slowly increasing things as your pain dictates is critical for success.